Alright, so this is part 2 of our liquid facelift. We're breaking this up into smaller videos so people don't have to watch too long of a video here. We already did our dental block and we started with the lip here, and we're going to continue on the upper and lower lip in this video here. So Miss Jenny here is really nice and numb and shouldn't feel any of this. Let me know if you do feel anything. We can always put a little bit more numbing in. I typically use a smaller needle in the upper lip so that we minimize the risk of any bruising. We'll stick. You feel that just a little bit? Is it tolerable? Okay. She's actually got nice full lips, so we don't really have to put that much in her. So I do a little shot right there for the Cupid's bow. You want to come ice this side for me? Alright, we're going to switch sides now, so I'm going to get my professional camera girl to rotate a little bit. We're going to have Kim ice her other side there. Alright, let me know if you feel anything. That's the advantage of doing the numbing shot, is that this makes the patient really nice and numb and they don't feel anything at all usually. Sometimes a little pressure, but usually not pain. It does make you numb for a little while afterward, for about 2 hours or so afterward, but it makes a major difference in the pain tolerance. And you can see that we ice immediately, as Kim, my wonderful assistant, is doing. So that decreases the swelling and minimizes their risk of bruising.
What about arnica?
Yeah, we usually have our patients on arnica, which is a little tablet that they take afterward to minimize their risk of bruising. Alright, turn toward me a little bit. Alright, so I'm trying to let the camera see what we do here. Little stick. And this is recreating the Cupid's bow for me. Almost done with that. It helps to give them just a little bit more of a perk. Maybe a little difficult to see on the camera, but now she's got a nicer upper lip, and I didn't really have to put much in the bulk of the lip, which is the mistake a lot of people make, because they put too much in the actual pulp of the lip, which makes their lip look huge. And all Miss Jenny needs is just a little amplification of her little line right there. So, all right, now we're going to do her lower lip. Let's make sure she's numb first by doing a little test poke. You feel me poking right there? Feel sharp at all? Okay. You can see that she's got a pretty good amount of size to her lower lip, but just needs a little bit extra. So we're going to do just a little bit of filler in her lower lip here. I only used about half a syringe on her upper lip, and we'll probably only use half a syringe on her lower lip. So for somebody that doesn't need a lot of filler, they can come in and only have to buy one syringe, and that gives them a nice upper and lower lip. Open for me just slightly. There you go. Perfect. You can kind of see how I'm just kind of going along the border here to put just a little bit in. And she doesn't want anything that's going to be real noticeable. She just wants a little bit of fill. So going to be real nice and conservative. Do a little bit of pill rolling here just to make sure it's nice and even. You can see if you take your time and use a smaller needle on the lip and do a little bit of icing before and afterward, it really hardly have any bleeding at all. Almost finished here with this side. See, she's got one little spot of blood right there that I'm going to get my assistant to come over here and hold a little pressure on while we do the other side. I'm just kind of pinch the lip. Now we'll get this side done here. Little stick. You feel that? Good. So there's the advantage of doing the numbing shot. You can see that she's completely numb and doesn't feel this at all. And I'll be perfectly honest with you. If all she had was the numbing cream, she probably wouldn't feel the initial stick, but she would still feel the volume going in. So I've found that patients do not tolerate too well this procedure if they just have the numbing cream. numbing cream just doesn't get them numb enough deep. So some of my patients have come from other offices that do not do the numbing shot and have honestly told me that it's much easier to get this done. So we're going to finish up her lower lip here, and then our third part of the video is going to be the rest of what we call the liquid facelift, which is going to be a little bit in her cheeks and her jawline. We're going to end up using a total of 2 syringes on her for all the areas, including her nose, which we did in part, actually a separate video. Put just a little bit more in the middle here, and we'll be all done.